At this time, I wanted to invite my colleagues Aaron and Alex, both program consultants here at the American Heart Association, to come off of mute, and we're going to just hold our Q&A section. If you have any questions, please remember, go ahead and fill those out in the chat. If we don't have an answer for you today on today's webinar, we will definitely connect with you offline or potentially put those questions in our frequently asked questions document, and that will be available to you beginning next Thursday, the 19th. Aaron, Alex?
Thanks, Gino. This is Aaron. Hopefully, Alex, you're able to come off mute as well. But I did want to pose a few questions that did pop up that I thought were we could address here at the end of the webinar. The first one is, based on the final version of the 2023 EMS recognition criteria sheet, it appears that contrary to the preliminary info that was provided last year, there's no longer a systems of care measurement for stroke intervention time metrics on the hospital side. Is this correct? This came out of Cincinnati.
Thank you for the question, Aaron. Yes, that is correct. So as I said, a couple of the systems of care awards had been modified for this year, and working with our stroke systems of care volunteer experts, that includes pre-hospital providers as well as physicians across the country, we noted that there is still a little bit of work to do, that we need to be able to integrate our hospital components with our registries. And so we will be looking for the future, and you can expect to see those as the two measures that you're referring to, as probably well as some other meaningful stroke systems of care. You'll see those in next year's recognition. In this year's recognition, you'll find at the end some questionnaires about how your agency may or may not participate in stroke systems of care. And so I encourage you to fill those out, as well as there'll be a box at the end to fill out any specific information that your agency does. We'd love to hear from you as we continue to build out those stroke systems of care for EMS.
Thank you, Gino. And Gino and Alex, I think this is one we've actually talked about before, but and it's a great question. How are agencies addressing when a stroke is suspected, but the notification criteria is outside the stroke window for their system? For example, a provider recognizes a stroke, but the notification is only required within the last known well of 6 hours or 24 hours. Would like to know how people will capture numerators and denominators for this measure.
Thank you for that, Aaron. Alex, I can take maybe the first part of it, and then feel free to jump in at any point as well too. But it is definitely something that we had talked about before, and that we attempted to address in our measure criteria. You know, as we look at stroke systems of care across the country, we often find that sometimes our hospitals, maybe two systems in one city, might require different levels of notification depending. And how do we capture that agency that might be transporting a patient, but the ER attending physician says, let's not make this a neuro alert, we'll just see them at bedside. And so what we attempted to do was include these into our exceptions and our exclusions. And so I don't want to speak on the specific measure because I don't have the document in front of me, but you'll be able to find in there which NMSIS codes attribute to that. And so you can see that in the exception section. And in some cases, they are case by case depending on your EMS agency. And so while you're filling out that form, or maybe even before that you open it, feel free to send us an email, and we'd be happy to get online or answer it obviously offline with you as well, and figure out what that might look like in your area.
I would also just add that, as part of your patient care, you are in communication with the hospital, and you are providing information about maybe a stroke severity scale, stroke identification scale, or some of the physical findings that you're having with the patient. And in some ways that is pre-notification, even though there may not be anything that happens with that information.
And Alex, thank you for that. And Aaron, the other component of it is, as well as and we noted this in the measure narrative, but sometimes the second question to that is, what pre-hospital stroke scales does the American Heart Association recognize? And so all of the pre-hospital stroke scales are listed there. And we acknowledge that some use different stroke scales. Some might be a Cincinnati, or you might use MRACE, or some might use an NIH scale. And so the LA pre-hospital scale, for instance. So we have all of those also listed in our measure narrative. And again, if there's any questions on that, we'd be happy to take those.
Yeah, great point. Thanks, Gino. I think you addressed this potentially, but I will bring this out in front of everyone again. When should we expect the application links, and who should we contact if we don't receive the link by that time?
Absolutely. So the application links as well as the website updates will all go live by next Thursday, January 19th. And so what our plan is we're making a coordinated effort with our marketing teams here at the Heart Association. And so we'll have all of the documents, so including that measured narrative that I keep referencing that some of you, that all of you don't have yet. There is an old version that might be circulating out there from 2022, but the most updated version will be coming by next Thursday. That as well as that worksheet that we discussed and the physical application link will all go live by Thursday, January 19th. And then anybody that registered for this webinar, as well as some of our other national distribution lists, and so we'll get an email saying that everything is live, and we'll also be able to provide those PDFs right to you as well.
Very good. Another great question, and I think this person has already left the chat, but I think we need to address it real quick. Here's the measures document was removed from the website, and Gino, I don't remember if you addressed that at all. Will this be included in the post-webinar email?
It was, yes, it was removed. I had woke up this morning, and when you plan webinars, there's always what did we do everything correctly? So I got up, I made sure everyone's looking, and I realized that the wrong one was on the website. So I reached out to our marketing manager today and our national director of marketing, and I said, let's get that off of there so we have no confusions. So yes, in the long, it was removed, but it will be re-updated on the website, and they'll be receiving that the link to the website post-webinar. And so we don't want to inundate everyone with multiple links. What you'll receive is that website link, and then on the website you'll find all the PDFs and the step-by-step process on how to apply. And that way that helps folks be able to say step 1, step 2, step 3 through the application. So you'll get the website link, and then by next Thursday you'll see the website update with everything that we talked about today.
Very good. Okay, I'm looking to see here. We've answered some of the ones about the application links. I'm going to post the website so that folks can check that. If an agency hasn't applied prior, are they still only available for silver initially, or are they able to get gold for a first-year applicant?
That is a good question. And so I'm assuming that they're probably talking about our first tier, or our first section, our pre-hospital award. And so if they're able to, if they have not applied, let's just say if they have not applied before, they're able for our bronze and our silver. It is contingent, I guess, it's kind of twofold. If they were a part of like a joint or a regional, it might go based off of like what their primary agency was in that application. But all of those specifics are going to be in that frequently asked questions document. That actually is live on the website. And so if you go to the website today, there's a hyperlink on there that says frequently asked questions, and it does go over some of those specifics on how folks either move down or move up in the Mission Lifeline EMS Recognition program.
Very good. Thanks for the clarity.
I might add to that, Aaron, too, maybe just briefly mention the AHA EMS ID again, because there will be a list whenever you go to apply that will show there's about 20,000 EMS agencies across the nation. And so your agency is either on that list or will be on that list. And there's a unique AHA EMS ID to your doing business as agency. And so you'll put that into your application link, and that's going to help us on the back end see what agencies have applied, and then be able to just clean up all of our data to ensure that we award the right levels this year. And so that was a big opportunity that we realized that we haven't done in previous years, which was have that unique identifier. And so the agency that might have applied in 2020 as EMS, in 2021 as emergency medical services, and and et cetera, that those aren't 2 or 3 or 4 individual records, but that they're all one succinct record. And so that's something that we're looking forward to this year, and We appreciate your help as we continue to strive. Obviously, there is a data component whenever we institute something like this that's new. And so there will be a little bit of growing pains with those, but we're going to really work hard to clean that up so that way in 2024, we are ready to move into our new software.
Thanks, Gino. I don't know if we need clarification on this one. This one comes from Sarah, but it was mentioned that the application is individual entities only. Can local EMS agencies still submit an application? I don't know if she's looking for maybe like, where you have the previous like group or team type thing. Gino, maybe you could address that, who's eligible and how they're an individual entity.
Absolutely. Yeah, thank you, Aaron. Yes, Sarah. So before some agencies, so let's say you were the non-transporting fire department in your community, in some instances, you partnered and collaborated. You were essentially a team member with that primary transporting agency in your community. And so let's just say fire department QRS partners with ambulance service XYZ. So the ambulance service XYZ just includes the fire department on their application, and then there was a joint certificate that went out. This year they're individual applications, and so the fire department and the ambulance service will both apply. Now let's say the fire department is only that non-transporting agency. They are only eligible for AHA EMS 1 through 7, which is our EMS pre-hospital award. And then similarly, the transporting EMS agency is eligible for that, but then if they participate in systems of care with the local or regional hospital system, they're eligible to submit for that target STEMI award as well. Did that answer it, Aaron, or maybe a little more confused now?
Well, yeah, I hope it's clear. And folks, we can also address again, just reiterate on some office hour stuff that's coming up and over the next couple months. We'll address some more questions as we get those in, just for clarification, because I know everybody's got a lot of questions. Okay, the next one I've got, there's a lot of questions about the aspirin administration. Let's be open about that. We're not going to get granular on that right now, and the reason we don't is because you all have your own local protocols and guidelines on your ASA administration. Now, how do we apply that towards the metric? That's going to be the way you apply it to the metric. If you believe that the patient took and self-administered aspirin prior to, and you want to document that, that is completely fine. If you follow your protocols and you choose to use that as in part of your measure, as part of your numerator, then that's yours as well. I don't think we are going to get into the too granular on that. It really is going to come down to how you would like to approach that, as far as including that in your numerator and denominator. And Alex, if you have anything extra opposing to that, feel free to speak.
Again, I think you hit it on the head there, Aaron. I think what we're trying to do is make sure that if a patient is having signs and symptoms of acute coronary syndrome, that prior to the hospital arrival, that patient is receiving an aspirin, and whether it's patient self-administered, dispatched, directed, or you give the aspirin yourself, that happens. And hopefully most of you should be documenting that information to provide to the hospital that an aspirin was administered, whether it was you giving the aspirin to them or the patient taking it themselves. So, I think that's, trying to capture that bit of data is important. So, did the patient get an aspirin? Yes or no, prior to arrival to the hospital? This is really kind of, to me, the nuts and bolts of that numerator denominator.
Yeah. Thanks, Alex. That's a good question, though. We understand that. Okay, so we've got, since we have stroke metrics on here, this question's last year for strokes. There was a listed requirement for 15-minute on-scene time for EMS. Is that a requirement?
So I'll jump in here. So our stroke volunteers have taken a long look at the guidelines, and there's been a lot of great research coming out about stroke systems of care over the last year, and we're trying to make sure that we align any of our measures that are science-based and I think there is still some research going on about scene time, both for STEMI and for stroke, and making sense of, how long a EMS provider should be on scene, and obviously doing an ECG or doing a stroke severity scale and getting last known well and doing diabetes all take a little bit more time than, just scoop and swoop. And so I think, our volunteers want to make sure that we are allowing sufficient amount of time for you to do the evaluation of the patient and doing any care that's appropriate, and kind of just monitor the guidelines and the best science and what's coming out as to what makes sense for scene time. Saying that it could be back there next year. It could be one of those things that, it comes back and, it's going to take, 25 minutes to do all that, without being rushed and doing good patient care. So I think that the scene time, along with the measures related to first medical contact to thrombolytics and first medical contact and endovascular for stroke, are something that, our volunteers will look at over the next year.
Thanks, Alex. Good question, Rob. How do you suggest obtaining information to report on the systems of care measures? I think, we could probably have an office hour on that alone, because it's a little bit different in each system of care model. I would say that, Gino, I think maybe we could mark this up as a topic we cover in an office hour, because that's really your relationship with your hospitals and all the entities that are involved in the patient journey. So hopefully, I would like to address that in a further one if we could.
That sounds awesome.
Yeah, and I'll just, again, having been here for a while when we rolled out Mission Lifeline and that STEMI systems care measure, there was a lot of pushback or a lot of consternation by hospitals and EMS around that measure. But over time, working with hospitals and EMS, that data became more available to EMS providers, and it's definitely important at looking at the outcomes of care for your patients. This shouldn't be just a measure that hospitals care about. This is a measure that EMS should be very much interested in. And it's something that we will work over the next year with our stroke coordinators, the same way that we worked with our STEMI coordinators back in 2007, to show the importance of sharing that information, providing good feedback to EMS around stroke measures. And so it's definitely on our list of things that we will be reaching out to stroke coordinators this year to help educate them on the how to do it and why to do it.
Right. Thanks, Alex. Okay. This is an interesting question, Matt. Thanks for this one. If the EMS agency and area hospital both upload data to get with the guidelines, will this not be duplicate data being entered on the same patient?
That is a good question. Thank you. Yes, Matt. So this was one of the benefits to using that AHA EMS ID, because your agency is already linked to that hospital via your AHA EMS ID. So really, we're just incorporating it on our end. Now, our smart sheet that you'll fill out for your EMS recognition is separate than our Get With The Guidelines registry. And so if we're talking specifically about those systems of care, we might perhaps want to just have an offline conversation. And so I'd encourage you to just send us an email on it, because we could take a look at your data and look at the collaboration between you and your hospital to make sure that we're entering it. The duplicate data, it won't necessarily affect 1 through 7. Alex, if you have anything else to add on that, but I would encourage us to probably look at it offline, because that's going to be agency versus and hospital specific collaboration. The AHA EMS ID will be the same identifier for your agency, Matt.
Yeah, and the good thing, the great thing or the good thing with adding the AHA EMS identifier that the hospitals use to enter their data and to Get With The Guidelines. To your point, they'll be able to pull your data out more quickly to make sure that they're able to provide that feedback and data sharing in the future. And you never know where this may go. That maybe there's an easier way for us to push that data or build a mechanism for the hospitals to more easily push that data to you in the future. But if your number is 1, 2, 3, 4, you'll be able to go to hospital and ask for your data more easily to Get With The Guidelines.
Very good. We have a question on a specific metric, and I believe it's addressed, but let's bring it up. For AHA EMS 8, which is FMC to PCI in less than or equal to 90 minutes, is PCI the marker for perfusion time, or is it when patient reached a cath lab? And with that, if EMS does all required, but cath lab has delay, why does this affect EMS data? Hospital has data from door to perfusion time of less than or equal to 90 minutes, not FMC, not EMS FMC.
Thank you, Aaron. Yes,
Yeah.
it's one of those things that whenever we look at the systems of care, and obviously Alex might have some to add, just having the historical knowledge on our target STEMI, but it's always constantly evolving. And so we're looking at guideline-directed care. We're working with our stroke subject matter expert volunteers, as well as our coronary artery disease and our mission Lifeline volunteers. And so the PCI to perfusion time, so it is not when it is for perfusion, it's when the PCI actually happened, and that's in our EMS measures narrative. The specifics about delays, that gets into our exclusion and our exceptions section, and it is addressed in our measure narrative as well. And so it's one of those things where we acknowledge that sometimes that delay doesn't actually happen because of the EMS agency, and all of that has been done correctly. And there might be a delay on the hospital side, and so we do attempt to account for that in our document. And you'll see the various NMSIS codes that you can use to pull that information.
Thanks, Gino. And Joshua, I think this is a great opportunity for the systems of care, and this is your multidisciplinary meeting coming together, and you folks bringing that to them, and and asking questions, and that's part of the PI process as well. I think it's a great opportunity because the system only works if everybody is rocking and rolling. So, okay. If an agency is a transporting agency but has to fly out STEMIs from the scene due to not having a local interventional cath lab, this is obviously going to affect their reperfusion times. Is there a way for them to apply and still obtain recognition even though they don't meet the standard times due to utilizing air medical? And if I can take a personal privilege, I would say that this is a challenge that we see in Alaska. But yes, go for it. If someone else would like to address that one, they can.
Yeah, absolutely. Thank you for that, Chris. So yes, I'm assuming that you mean, are we still eligible for, I'll talk about the first recognition, our EMS pre-hospital recognition first. Absolutely still able to submit that level with our first section there that I talked about, AHA EMS 1 through EMS 7. For your specific systems of care, that is, when it involves aeromedical, it is that systems of care component between, is the patient arriving at PCI capable? Is it a STEMI receiving or a STEMI referring? And so, yes, you still have eligibility requirements there. And again, we can show you which NMSIS codes you can pull, but you certainly are still eligible to receive that EMS pre-hospital award.
Thanks, Gino. And it's very interesting that you would fly your STEMIs out from the scene. And it would be interesting to know the geography and whatnot, but not to get too granular on that one, Chris. But it's a good point. We do see that in certain areas that rely heavily on air medical. So, okay, do you have to include stroke measures to apply, Gino?
Thank you, Aaron. Yes, you do. And so I'm just going to go back here. So you can see here that you have, we're obviously looking at AHA EMS 1 through 7, the EMS award level. And so you do need at least one stroke patient to be able to apply for these. Remember that these are the process measures, these are the patient-centered care measures that we can do as pre-hospital providers on scene. These 1 through 7 do not include the hospital component of it, the integration with the systems of care. And so you'll need at least 4 patients. So you could have 3 STEMIs, but you do still need 1 stroke patient.
Very good. A scenario question a little bit. We had silver in 2020. but didn't fill out the paperwork for 2021. Will that affect us on getting a bronze award?
Thank you for that, Aaron. I will defer that question to the frequently asked questions only because we address how you can move up and down the award tiers there, and I don't want to confuse anybody online here. If there might be moving from silver to gold or gold to silver or how they move to bronze. So I did address all of that in the frequently asked questions. And Greg, if you have any questions after that, feel free to send us an email, missionlifeline@heart.org, and we can take a look at that specifically. I can also go in and pull your agency data like in our software. And so I can make sure that, you know, we have all of those links and things where we hope the AHA EMS ID will rectify some of that this year.
Very good. And I think you did address this, Gino, but one more for clarification. There won't be specific agency application links. It is a general link. Is that correct?
That is correct. Yes.
All right. Very good.
And
I think that's where you addressed with the AHA ID as well.
Absolutely. Yes. And
Right.
there's no, there are no like logins or needing to save any of those like Qualtrics resubmission and resetting of the links, the issues that we had last year. You shouldn't have any with that.
Very good. If this is our first year applying for recognition and assuming we meet all of that minimum adherence, volume, and time period compliance, the high award level we could receive would be the silver award. Is that correct?
Yes. Sorry, I was trying to find my unmute button there. Not like it disappeared in the last 40 minutes or anything, but yes, absolutely. And if this is your first year applying, Josh, it's so great to see that you have gotten to here to apply. Feel free to send us an email, and we're happy to go ahead and chat with you offline to make sure that we can answer any specific questions that your agency might have.
Very good. Okay, Sarah, yeah, I think this is where you're going with that. Our local EMS agency submits an application on behalf of all the provider agencies within LA County. And I think Gino and Alex, I think we actually discussed this specifically. Maybe we could clarify on how that works.
Sure. The application, so yes, it is the individual applications here. And so this might be, this might be an offline question, Aaron, just for the fact that specifically whenever we get into some of those regional areas and coalitions across the nation, we have separate denotions in the spreadsheet there, so that way we can make sure we're linking them. Ultimately, each agency will go ahead and submit an individual application, but I don't want to give that as a definitive because some agencies use the same EPCR, or some hospital systems use the same data. So yes, Sarah, I guess in the short that you would be submitting individual applications. We acknowledge though that this year, while that might seem a lot, especially if you submit, if you're submit on behalf of multiple agencies, we hope that the simplified form will help. And then moving forward, a little teaser for the 2024 plus time is that we hope to be able to move into some sort of certification dashboard. And so we have some software available through the American Heart Association that we're currently in the pilot program for, to be able to get you access to be able to have a login again. Multiple people can have logins, and then that way you can kind of see all your data in one area in one dashboard. And so it might be a little burdensome this year submitting individual applications, but hopefully just needing those numerator denominators can help you quickly abstract. But I'm happy to chat with you offline about it too and get on a call with you.
Thanks, Gino. And then, so let's go back over the systems of care heart attack award measures here on number 8 and 9. There's a question, are both required to be submitted in the application, or one or the other? And the reason being is this particular fire department organization strictly transports to PCI capable hospitals. They have never tracked door to thrombolytic times before, only FMC to device times for positive STEMI patients, and it causes a little confusion on why we're doing that.
Absolutely. Yes, so AHA EMS 8 and AHA EMS 9 for the 2023 recognition are both required. They have to have at least 4 STEMI patients for the calendar year, and they are destination specific. So for your agency that transports to your receiving or to your referring, you're going to see in the FAQ document which are eligible, which destination types are eligible. And so
Did we lose you,
can you
Gino?
hear me?
Yep, I can hear you.
Okay, perfect. I'm not sure how much was coming through or not. I realized that I just flashed up on mute. Did you hear me answering any of that?
A little bit. Why don't you address? Why don't you go back over that real quick?
Sure, absolutely. Yes, so their AHA EMS 8 and AHA EMS 9 are dependent on whether you're transporting to STEMI receiving or to STEMI referring. In our FAQ document, Steve, there is a section on there that will show you which is available for which. And so you need at least 4 STEMIs, but you're absolutely right. In some instances, whenever you're tracking it, it doesn't, it's not applicable. It's not applicable to maybe your STEMI receiving or to your STEMI referring. And so that is in your, one, your measured narrative, and 2, in your frequently asked question. Alex, if you have anything else to add, I didn't mean to walk over you if you were speaking. I think my computer.
No, you hit it on the head there, Gino. Thank you very much.
Absolutely.
Okay, again, I think we kind of just went over this a little bit, Clint, but that's the ambulance service that applies for Mission Lifeline by districts. Would each district have a unique AHA identifier? That's a good question.
That is a good question. Thank you, Clint. If you can send me an email to missionlifeline@heart.org, I want to pull up the specifics on what you're referring to so I can cross-check that with the spreadsheet. Because districts to some are different to others across the nation. And so I want to minimize the confusion on that. So let's take a look at that together. And I'm more than happy to do that with you. Just send an email, missionlifeline@heart.org.
Very good. For the purpose of establishing a first medical contact, if a patient time is not documented, is there a surrogate? And I think we addressed this potentially in the probably some of the documentation. Is that correct, Gino?
Yes, absolutely. And what we hope to do too with some of that documentation, like I said, is add those nemesis codes that will help you show what fields you have to pull. But when in doubt, I would say refer to that measure narrative that we'll be posting next Thursday, as well as the frequently asked questions section on the website.
Very good. We do have someone stating that they cannot find the frequently asked question doc. Can you share the link or tell us where exactly it resides? And I believe I shared the link in the chat.
Yes, and Jason, thank you for that. What you made me realize that I should probably mention is that there's a delay in getting that uploaded. So I do know our national marketing director pushed those updates, but normally they'll update throughout the day. So I think you pushed it around noon, so it probably missed that morning window for updates. Just give it 24 hours and it'll update. But I saw the proxy website earlier this morning, so I do know that it's going to at least post. There's a section underneath of where the application process is, but you're right, it might not have migrated through just yet.
Very good. I believe we have addressed the questions.
Wonderful.
I would say, thanks, Gino, again. When this information comes out, he's got a slide there. It's got some information that will help provide some avenues to contact us, and so that we can get some questions answers. Hey, great questions, everybody. And I'm going to toss it back to you, Gino. Thanks.
Thank you, Aaron. Thank you, Alex, so much for helping with the question and answer section and for all of the work that you've done this year on getting this Mission Lifeline EMS recognition program off the ground again. I just want to remind everyone, March 31st is the day to know at 11:59 Central Standard Time. The application portal will close. Give us until next Thursday, January 19th, for the updated link to be able to submit your application. That also is going to be whenever the application opens, as well as that measure narrative will be posted by then. If you have any questions, feel free to send us feel free to send us an email. And I'm going to go ahead here and I'll link these slides here at the end of the presentation. You'll get a link to those in our after action email. But right here on the slide deck will be our mission lifeline at heart.org, and so that'll be your email that we'll be answering throughout the year. Go ahead and direct those specifically to us. If you did previously email any of our QI staff or anyone specific at HA, feel free to CC them on the email, but definitely want to send questions if you have anything related to the EMS Mission Lifeline EMS Recognition Program to our mission lifeline at heart.org, or go ahead and visit our website after January 19th. We'll have it all updated. I think that is everything. We appreciate all of you so much. We're very excited in our 2023 recognition and seeing what we're able to do for 2024 and beyond. We thank you for all of your work in your communities. It's because of you, people have a world of longer, healthier lives. And so on behalf of the American Heart Association, thank you for joining us today. If you have any questions, please reach out. And if not, have a great Thursday. Thanks, everyone.